Welcome to This Explainer. Today, we're going to dive into an incredibly empowering framework that basically flips the script on how we view human motivation. We're exploring Adlerian Therapy, which is also known as individual psychology. Let me tell you, if you've ever felt completely boxed in by the idea that your past entirely dictates your present, you're going to find this analytical breakdown absolutely refreshing. So think about this for just a second. Are you merely a product of your history, or are you the architect of your destiny? I mean, are you driven by what happened to you years and years ago, or are you actually pulled forward by the future you want to create? Now, this isn't just some abstract philosophical thought experiment. This is the literal dividing line between two totally different ways of understanding the human mind. All right, let's really get into this. For a long time, early deterministic psychoanalysis completely dominated the conversation. That older view essentially argued that we are the direct result of our past causes. It was intensely focused on what happened to us. But then, Alfred Adler comes along and pioneers a massive deviation from that deterministic view. Adlerian therapy shifts the focus entirely. It emphasizes the purposive, goal-oriented nature of the individual. So instead of asking what caused this behavior, Adlerian psychology asks, what is the purpose of this behavior? It's a total game changer. It shifts us from constantly looking backward of the past to looking forward to the future. Now, to really ground our analysis today, we're pulling the core tenets right out of the source material. We're going to decode the theoretical foundation of Adler's approach so we can truly understand how this paradigm shift works in actual practice. Part 1. The 4 core tenets. Let's look at Adler's foundation. The very first pillar is holism, or the unified self, and this is huge. Adler completely rejects the idea of fragmenting the human psyche into competing internal parts. You know how sometimes people say, well, part of me wants this, but another part of me really wants that. Adlerian theory says no. It views the person as a unified whole. Analytically speaking, every single aspect of your personality, your thoughts, your feelings, your behaviors, is seen as moving in the exact same direction toward a singular life goal. You aren't at war with yourself. Your entire system is unified in its pursuit of an objective. Okay, moving on, let's look at teleology and fictional finalism. This is where we make that massive, crucial shift from cause to purpose. Adler understood behavior not as a reaction to past events, but as a deliberate movement toward a future-oriented goal. This ultimate goal is what he called fictional finalism. Actually, I want you to think about your own ultimate life goal right now. Whatever that is your fictional finalism. It's your own subjective map for achieving significance and security in the world. And according to Adler, every behavior you exhibit is just another step on that map. Which brings us to a fantastic, complex German word, Gemeinschaftsgefühl. This translates to social interest. You see, Adlerian therapy doesn't just look at an individual isolated in a vacuum. It heavily emphasizes our social context. Social interest is that feeling of being part of the human community combined with a genuine desire to contribute to the common good. In fact, Adler considered this the absolute primary indicator of mental health. Analytically, what we usually label as psychological distress is framed in this theory simply as discouragement or a lack of this social interest. Basically, when we lose our connection to the community, we become discouraged. And the final of our 4 core tenets is the striving for significance. Our source analysis centers on this innate human drive to move from a perceived minus position, which is a feeling of inferiority, over to a plus position of mastery or superiority. Now, we really need to clarify what this means. This is definitely not viewed as some toxic quest for power or dominance over other people. Rather, it's an internal, personal struggle for competency and self-actualization. It's just that natural human desire to grow, to master new skills, and to become fully actualized in whatever it is we do. Part 2. Clinical evaluation. Let's dive into the strengths and efficacy. When we look at how effective this is in practice, a few major strengths really stand out. First off, agency and empowerment. Because this therapy zeroes in on purposeful behavior and choice, it fosters a massive sense of personal responsibility in clients. You aren't a victim of your past. You're an active agent choosing your path. Second, it promotes an egalitarian relationship. It builds a collaborative, democratic bond between the therapist and the client, which effectively tears down that traditional rigid expert-patient hierarchy. And third, it is highly effective at utilizing social context. For example, it deeply addresses how family dynamics, things like your birth order, and your sense of community belonging directly influence your identity. Now, while the clinical efficacy is quite clear, maintaining pure objective clarity means we absolutely must balance these empowering strengths with the framework's limitations. Having a balanced view of the whole shebang is essential here. Part 3. Clinical Evaluation, Limitations and Critiques. The clinical evaluation outlines three main drawbacks we need to consider. The first is subjective assessment. Adlerian techniques often involve analyzing a client's early recollections. As you might guess, this is highly interpretive and relies heavily on the individual therapist's skill and subjective intuition, rather than hard, objective data. Second is a lack of empirical precision. Core concepts like striving for superiority are incredibly broad and philosophical. That makes them pretty difficult to measure empirically in strict clinical research settings. And finally, cultural variations. While the concept of social interest is universal, the specific ways it gets expressed can vary wildly across different cultural and collectivist contexts. Practitioners really have to navigate those nuances carefully. Part 4. The Power of Purpose. Let's synthesize the theory. So, what does this all mean? Ultimately, Adlerian therapy remains a remarkably powerful framework, specifically because of its non-pathologizing, holistic, and socially conscious approach. It doesn't look at you and ask what is broken. Not at all. Instead, by evaluating the individual within their social system and focusing on the actual purpose of their behavior, it provides a very clear, optimistic pathway for reorientation and meaningful social contribution. It's really all about finding where you belong and figuring out how you can move forward. Adlerian psychology teaches us a vital lesson. We are not pushed from behind by our past. We are pulled forward by the goals we set for our future. Every thought, every feeling, and every single behavior is a unified movement toward a destination. So if every behavior has a purpose, what is yours? What is the future that you are building? Take a moment today to reflect on that map you're following. Thank you so much for joining me for this explainer, and keep striving for that plus position.